In healthcare, prevention measures such as vaccines and surveillance have always been game changers, rewriting the story of diseases that ravaged humanity and stole the lives of millions. Decades ago, diseases like measles, whooping cough, and polio were relentless predators, claiming the lives of countless children in Nigeria. But science fought back with the discovery of vaccines, which turned these deadly diseases into preventable conditions, giving hope to parents and saving entire generations from untimely deaths.
For the benefit of all mankind.
And here in Nigeria, we are making history. The latest is the malaria vaccine officially rolled out for children in October 2024, marking a major breakthrough in the fight against a disease that has plagued our nation for generations. True to its word, Gavi, the international partner, prioritized Nigeria in its rollout plans through the National Primary Healthcare Development Agency (NPHCDA), selecting Bayelsa and Kebbi states as pilot locations.
I'm very happy for seeing this because I know how many times we come to hospital to take malaria drugs for our children.
The launch of this vaccine intervention, we're optimistic that we can create a healthier, more prosperous future to our people.
Parent has an opportunity to immunize their child against malaria, they'll take advantage of that. State government will also step up and find ways within the increasing revenues that they have, how they can complement federal government in terms of co-financing.
These are mothers inside Eko Abasi PHC Center, Calabar, Ward 2 in Cross River, one of the states with higher number of zero-dose children, and drivers of immunization program have been speaking on limitations.
Recently, we had stock out of antigen and we missed. So we had missed opportunity, which during this recent measles campaign. During the measles campaign, if you notice, in Cross River, we went out with our ROIs. All the antigens we went out because we wanted to catch up with all those that we had missed opportunity during the stock out. Then that of from the aspect of the client, it has to do with poor knowledge. So we do a lot of advocacy, sensitization.
Also, in the year under review, Nigeria had its share of health crises, from the spike of cholera cases to outbreaks of Lassa fever, diphtheria, and even the return of mpox, declared a public health emergency. Governance at all levels with international support and other partners strengthened coordination in response to all public health threats.
We'll be recording cases for but we develop awareness programs, pamphlets, leaflets, even jingles. But bear in mind that all these cases come from different states and local governments. So in each state, because of their popularities, they carry out all these activities. After COVID, they will build a laboratory network. All states have laboratories with different scopes of activities. Most of these laboratories, we build capacities again for them to be able to test different diseases.
The Basic Healthcare Provision Fund, BHCPF, a federal government's project established to provide funding to improve access to primary health care, has been building capacity of health workers and availing vulnerable population insurance to access needed care.
We have visibility how those 4,600 facilities will be upgraded. Now, more than 8,000 facilities have been receiving direct facility financing through the Basic Healthcare Provision Fund in all the 36 states. And on the Vulnerable Groups Fund, the resources have also been channeled to provide enrollment and overall health insurance. According to NHIA, more than 2 million Nigerians have been added in the last 1 year.
Though it is a unanimous opinion that Nigeria is not where it should be in the health sector, but there are improvements, especially in immunization, which has been shading the nation's children, and other crucial interventions already yielding a healthier and brighter nation. In Abuja, Olusheye Adiagbo, NTA News.